Hello, this is the Global News podcast from the BBC World Service, with reports and analysis from across the world. The latest news 7 days a week. BBC World Service podcasts are supported by advertising.
This is the Global News podcast from the BBC World Service. Hello, I'm Oliver Conway, and this edition is published in the early hours of Tuesday, the 31st of March. Our main stories: there's been a steep drop in new coronavirus cases in Italy. Hungary's Prime Minister is given sweeping powers to tackle the outbreak there, but critics fear it will undermine democracy. And a new date is announced for the Tokyo Olympics. Also in the podcast, a US Navy medical ship arrives in New York to relieve pressure on hospitals. And
it certainly weakens your closer relationships, because we don't do this sort of touchy-feely stuff with everybody.
With all this social distancing, how much do we miss the human touch? Spain has become the latest nation to overtake China in the total number of recorded coronavirus infections. It means Europe now has more than 400,000 cases. But there continue to be possible signs from the two worst affected nations, Italy and Spain, that the rate of increase is starting to slow. However, the World Health Organization says lockdowns are only the first stage in tackling the pandemic and more needs to be done.
Everyone's talked about the curve up, and everyone talks about the stabilisation. The question is, how do you go down? And going down isn't just about a lockdown and let go. To get down from the numbers, not just stabilise, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. And then how do we take care of people better in a clinical environment to save more lives?
The head of the WHO's Health Emergencies Programme, Dr. Michael Ryan. But what of the new figures? They do tend to fluctuate, but on Monday evening, Italy reported less than half the number of new cases than the day before. I heard the details from our Europe reporter Gavin Lee.
For Italian authorities and Italians generally, that hope that this keeps happening. A rise in terms of the infection rate of just above 2%. That's the lowest it's ever been. It was just under 5% yesterday. Something very odd, though, in terms of the figures in the past 23 hours, actually, because the clocks went forward yesterday in Europe. Italy and Spain both confirming 812 more deaths from coronavirus. And in Italy, that means there have been 11,591 deaths. So, that is worrying. And last night, there was a webcam seminar between the senior doctors, medical staff of the top 10 countries most badly affected by coronavirus. The Italians said that they have been struggling, and they asked what were the mistakes for each country and what were the advice for countries. And the Italians said, we simply didn't check early enough. And they pointed to Germany, actually, and said one of the issues that clearly the Italians and the Spanish believe that's happening in Germany to make a difference in reducing that death toll, because the mortality rate is something like 0.4% there. It seems to be around 10% at the moment in Italy from known cases, was the fact Germany tested very early, very quickly, and a lot more. So that's one of the reasons being attributed to that. But the Italians and the Spanish believe that in the next 7 to 10 days, the number of cases will plateau and start to fall, both spread and the number of deaths. And we're seeing that in the spread so far. And just to quickly mention as well, the Spanish Foreign Minister today, Arantxa González, saying that the new measures that Spain has taken, almost on delay from Italy, they've put in the same measures as in not allowing anyone to go to work unless it's absolutely essential, so food and medicine, stay at home. And she said that Mondays are the new Sundays. That's the way it's going to have to be for some time.
So tighter measures in Spain, even as it joins Italy and the US in overtaking China. But are there still lessons that these countries can learn from the Chinese experience?
Yeah, there is a debate to be had here, and it's being sort of spoken in parliaments across Europe right now. And Serbia has become the first government to take wholeheartedly the advice of the Chinese in terms of a total lockdown. So the Serbian government had 6 Chinese epidemiologists visit in the past few days, and they've said things like what are seen as necessary extras like dog walking, for example, in countries in Europe, which is allowed, or exercise. Well, in Serbia, they've said that has to stop. They've cancelled the 1 hour a day dog walking, for example. People also have to stay indoors. They also use something that's quite controversial. They've agreed to mobile data location testing so that you and I or whoever's moving around, if they've been found to have coronavirus, they can be backtracked for the last 3 weeks to see and pinpoint the locations, people they've been in contact with, and therefore those people could be asked to go in quarantine. It's worked in China, South Korea, worked in Singapore too. Those countries say it had good success in isolating cases. In fact, one of our colleagues, Laura Bicker, spoke recently about how she received a text of somebody going to a nearby supermarket in South Korea being told by a government agency that somebody nearby had coronavirus. Well, that's now being used in Poland. It's been agreed on in Slovakia, Czech Republic too, and the Germans are debating this very thing. But Germany has one of the toughest privacy laws in Europe after the days of the Second World War and the Stasi and the Nazis and those memories. And so there's a lot of opposition saying, well, hang on a minute, this is too much. It amounts too much like spying.
Gavin Lee in Brussels. In Hungary, the hardline Prime Minister Viktor Orban has been granted sweeping powers to tackle the coronavirus outbreak there. Parliament, which is dominated by his Fidesz party, approved a bill allowing him to rule by decree. The government insists the law is necessary to fight the pandemic. Critics say he's using the crisis to remove the last checks on his powers. Nick Thorpe reports from Budapest.
By Monday morning, Hungary had 450 confirmed infections and 15 deaths, a fraction of the toll in many countries, but going up fast. The self-discipline of the population and the early introduction of a state of emergency have slowed the spread of the virus. But a bitter row has erupted over what happens next.
Örömmel fogadjuk a tanácsokat, a biztatást, mindent örömmel fogadunk.
A week ago, Prime Minister Viktor Orban asked Parliament to extend the state of emergency. All parties agreed, but the Prime Minister asked for extraordinary powers for an indefinite period. Zoltán Kiszely is a political analyst close to the government.
Hungarian politics, especially in eyes of Fidesz and Mr. Orban, is a majority style of democracy. They see that they have the majority behind them, they were voted in government, and so the opposition should make compromises. Not the government, because the government has the majority.
Journalists are worried by a change to the criminal code, whereby those who spread false or misleading information about the pandemic could be jailed for up to 5 years. That could be used against reporters who question government handling of the pandemic. By last night, more than 100,000 people had signed a petition against the new law. András Kada is co-chair of the Hungarian Helsinki Committee, a human rights group.
All the opposition is asking for is that there would be some element of control. In a situation like this, it is for the more powerful party to make the gestures. It is very difficult to trust this government with the track record of the past decades.
On Monday afternoon, Parliament passed the law. Opposition Jobbik party leader Peter Jakob told the Prime Minister that his hunger for power was the most dangerous virus.
Az, amelyik korlátlan ideig akar erősködni.
But the immune system of the Hungarian people will prove stronger. Viktor Orban said he would use his new powers proportionately and rationally. While other countries unite to tackle the virus, Hungary, it seems, faces the impending pandemic deeply divided.
Nick Thorpe reporting from Budapest. A US Navy medical ship has docked in New York to try to relieve the pressure on the city's hospitals. The vessel has 1,000 beds. New York State has recorded 66,000 cases of the virus, while 1,200 people have died. The New York City Mayor, Bill de Blasio, said help was desperately needed.
As the USNS Comfort entered New York Harbor, coming here to save the lives of New Yorkers in our hour of need. We've all been through a lot these last few weeks, and we needed this boost. We needed this hope that's being created by our brothers and sisters in the U.S. Navy. It's also about boosting the morale of New Yorkers who are going through so much. It's about saying to our heroes in those hospitals that help has come, that relief is on the way.
Jimmy Van Bramer is deputy leader of the New York City Council. He represents a district which includes badly affected parts of the borough of Queens. He spoke to James Kumarasamy.
Western Queens, where Elmhurst Hospital, which is receiving so much attention, rightly so, has been simply overwhelmed with COVID-19 cases. So the streets are rightfully so a ghost town. People are doing the best they can to get through a very difficult stretch, but clearly our caseloads just in Queens alone, which is one of the 5 counties in New York City, far outpaces all of the state of California, which has 40 million people living in the state of California. So we are very much at the center of it all, and it is a very trying time, to say the least.
That puts things into perspective. And as for the hospital itself, which, as you say, has had a lot of attention, there are lots of videos posted, one doctor saying it's being held together by a shoestring. What are conditions like at the moment?
It's a very large municipal hospital in the city of New York. It normally houses around 600 beds, and it is clearly overrun. The city is essentially turning the entire hospital into a COVID-19 ICU unit. And, I know that the trying times there have been well documented. I know the city has sent 100 plus nurses over the weekend as reinforcements, more and more doctors, more and more supplies going to the hospital. And I know they've begun transferring out any patient that is there for anything other than COVID-19, as many of our hospitals in New York City are turning into COVID-19 ICU units as more and more patients arrive.
And you have this arrival of the Navy ship to take some of the pressure off. It's got 1,000 beds. What's your view of the federal response? Does the White House, does Washington get things now?
No, let me say the Comfort arriving is a very good thing. It will take care of non-COVID-19 patients and allow others to focus on COVID-19. But the federal response, led by our utterly inept president, who has only made things worse. We are in a very dire situation, and to have a president of the United States delivering contradictory information, challenging our governor, and saying that we are misusing materials is outrageous and really just making it worse.
Jimmy Van Bramer, Deputy Leader of New York City Council. Rising stress levels brought on by the coronavirus outbreak and the subsequent control measures on our lives have prompted a huge increase in enrolment for an online course in wellbeing. It's taught by Laurie Santos, a professor of psychology at Yale, one of the top universities in America. She spoke to Razia Iqbal.
The course is called The Science of Wellbeing, and it's offered on Coursera.org. It's a version of a class that I taught at Yale University back in 2018 that became the largest class ever in Yale's history.
And how many people have been enrolling?
So for the first 2 years of the class, we had 500,000 learners enroll, which is pretty incredible. It's one of Coursera's biggest classes. But in the last 3 weeks, we have doubled that number. We're now up at, I think, 1.6 million learners with 20 million views of the course content, which is really surreal and incredible to get, 2 years worth of learners in just the last couple weeks.
And you attribute that entirely to what?
Well, I think right now in the midst of COVID-19, we're all very worried about our mental health. We're feeling more anxious and uncertain than we ever have been. And I think people really want to do things about it. We know right now what we need to do to protect our physical health, right? Everyone knows that they need to wash their hands and socially distance and stay, 6 feet or like 2 meters away from folks. But I think we don't really know what to do to protect our mental health. All of us are feeling more stressed than usual. And I think the class gives people some empirically based answers, some evidence-based answers for what they can do to feel better right now.
Outline for us what sorts of things are being taught.
So the class really begins with some misconceptions you might have about happiness. That happiness is really about how rich you are or your material possessions or even your circumstances. And this last one's important in COVID-19, this idea that, we have to have perfect circumstances to be happy. No, the research suggests you can take on challenges and increase your happiness that way. We then focus on the kinds of things that really do make for a happy life. Things like taking time for social connection, taking time to be other-oriented and worry about others, and making sure you're focusing on healthy habits habits like mindfulness and exercise and sleep. All of these things are critically important in the time of COVID-19. And I think my learners get to see some evidence that these are the things they should really be focused on right now.
And does it work? I mean, do you have empirical evidence to show that people who take your class do in fact change their mindset and are deemed in and of themselves to be happy?
So we measure people's self-reported well-being before and after the class. This is a standard, well-validated technique that a lot of research uses. And what we're finding so far, we haven't published these results, but what we're finding so far is that people on a 10-point happiness scale seem to, on average, go up a single point, which doesn't sound like a lot, but it's a statistically significant effect. In other words, if you're saying, like, normally I'm like a 6 out of 10 on happiness, at the end of the class, you're saying, actually, now I'm a 7 out of 10, which, again, in this day and age of COVID-19, can be an incredible improvement.
Nori Santos, Professor of Psychology at Yale. Still to come.
The fishermen are really now smiling at the Lake Victoria region because we are receiving more visitors.
A silver lining from the outbreak for the fishing industry in Kenya. A new date has been set for the Tokyo Olympics. The Games, which will still be called Tokyo 2020, will take place a year later than planned, in the last week of July and first week of August 2021. The International Olympic Committee said the delay would give the health authorities and the Games organisers time to deal with the disruption from the COVID-19 pandemic. The Japanese Olympics minister is Seiko Hashimoto.
I'm thankful that we are able to set a new date for the opening and closing ceremonies, as well as the Olympics and Paralympics quickly. I welcome this from the bottom of my heart. We feel it's better to hold the Games next year at summertime for the sake of transportation, volunteers and for the ticket holders around the world.
I heard more from our sports news correspondent Alex Capstick.
It's happened very quickly. The IOC said they'd need about 3 weeks to come up with a decision, but they've taken just a couple of days. And this was expected. It's what the athletes wanted. It's what the federations wanted. This is after a flurry of meetings, telephone calls, teleconferences between IOC members, federations and the organisers in Japan, and it was agreed pretty quickly that they would go for virtually the same dates as it would have been this year. They were thinking about the springtime in Japan, the famous cherry blossom season, but it was decided that clashed really with some big events in Europe, the end of the football seasons there, also Euro 21 next year, and also with the final of the NBA season. And NBC, the broadcaster, pays a lot of money to broadcast the Olympics, and it wouldn't really want to clash with such a big event in US sport.
And have they decided whether athletes will have to qualify again for the Olympics in 2021?
Well, that's a good point. And Thomas Bach did say a few days ago to one of his teleconferences that all athletes that have already qualified, and that represents about 57% of all competitors, they would have their place for 2021. Still a lot of qualification to go through, and that's why one of the reasons why they've gone for the option of staging it in July and August. It gives federations more time to organise their qualification events, and indeed it gives more time for athletes to prepare for those events and for those who've already qualified to prepare for the Olympics.
Alex Capstick reporting. So far, Africa has been much less badly affected by the pandemic than Europe, the US and Asia. But now, after a relatively slow start, the number of cases on the African continent has doubled in 5 days, reaching nearly 5,000. Ghana, Nigeria and Zimbabwe have all implemented lockdowns. In Zimbabwe, doctors have joined nurses in a walkout over the lack of protective gear. Shingai Nyoka sent this report from the Zimbabwean capital, Harare.
I'm in the heart of Zimbabwe's informal sector, a significant contributor to the economy. On a normal day, these stalls would be teeming with traders selling everything and anything under the sun. But because of the lockdown, they've been forced to stay home for the next 21 days. Many of them don't have savings and rely on daily earnings.
Even if you want to be a vendor, who to sell to, who, no one. Now, we are dying. To the landlord, they need the money and there's the money. Yes, of course, I'm not going to give him because where I'm going to get it? What for me to survive in my family? There is nothing.
The city centre is also largely deserted and most businesses are shut except for essential services like supermarkets and pharmacies. And the police are also out in numbers enforcing the lockdown, making sure that everyone who's on the streets has a right to be here. Zimbabwe has witnessed shutdowns before, several in recent years due to political unrest. But one of this nature, public health matters, is unprecedented. Zimbabwe is an uncharted territory, an already struggling economy with little to no safety nets for millions of informal traders and no bailout planned for businesses. Many would agree that this lockdown is necessary to stop this pandemic before it devastates an already fragile healthcare system. But in the coming weeks, Zimbabwe will have to count the economic cost, a cost it can scarcely afford, as many businesses struggle to reopen.
Shingai Nyoka in Harare. Staying in Africa and a boost for an industry which has been struggling. In Kenya, sales of fresh fish have risen dramatically over the past few weeks as a result of the global outbreak. Ferdinand Amondi reports on the situation in one community in western Kenya.
For local fishermen at Dunga Beach on the shores of Lake Victoria, business is booming. Sales of fresh fish in Dunga shot up by around 40% in just 2 weeks because of coronavirus. Less fish is being imported from China, the source of the outbreak, and people are also nervous of buying any Chinese produce that does arrive. Both these factors have increased customer demand for fresh lake fish. Maurice Misodi is a fisherman and leader at the Dunga Beach Management Unit.
The fishermen are really now smiling at the Lake Victoria region because we are receiving more visitors. Right now, when you see Dunga is really crowded with a lot of the residents of Kisumu coming to buy the fresh fish because people fear the Chinese box fish due to the coronavirus.
Before the coronavirus outbreak, the local fishermen were struggling to sell their catch. Fish sold from the lake costs about twice as much as the fish from China. The much lower prices of the imported fish meant that in most cases, the local fishermen would either end up eating their catch themselves or sometimes give up to half of it away. But Jacqueline Nyaboro, a fishmonger, says now customers are willing to buy the fish at any cost.
With the presence of the coronavirus, those people who are selling China fish have got some disadvantage because at the moment they are unable to do their business. And I, as the person who is selling the lake fish, now I've got the advantage to sell fish with the price I want.
At one of the fish markets, boxes of imported Chinese fish still in stock are changing hands. Kenya imported more than $23 million worth of frozen fish from China in 2018. Those in the industry around Africa's largest lake have long complained that the cheap imports were harming local trade. Chinese fish usually made up about 50% of the market, but this had now fallen. But the scarcity of Chinese fish isn't all good news. The high local prices are making it difficult for some fish retailers like Caroline Ochieng to make a decent profit.
As women trading in Chinese fish in Kisumu, we see when the Chinese boxed fish arrives here. We do get it cheaply, and when it is not there, we get this fish from our own lake. But it's very expensive. That is the reason we want the Chinese fish in supply, as well as that from our own lake, so that as we do business, we don't feel the burden.
That report from Kenya by Ferdinand Amondi. The Singer Laren Museum in the Netherlands has said that a Van Gogh painting was stolen from its premises on Sunday night. No other paintings were taken. The museum is currently closed because of the coronavirus outbreak. Anna Holligan reports.
The thieves entered by forcing open the glass front door just after 3 a.m. They took one piece, an oil painting, Parish Garden in Newnan, Spring. Created by Van Gogh in 1884, it depicts an old ruined church in the village in which the Dutch artist lived for 2 years. Police have sent out an appeal asking neighbours to check their closed-circuit cameras for clues. The painting has been placed on Interpol's international list of stolen artworks with a warning to potential buyers.
Anna Holligan. Thanks to technology, we can still see friends and family and talk to them while we're stuck at home. but we're not able to share the human touch. So how much do we miss it? Robin Dunbar is Professor of Evolutionary Psychology at the University of Oxford and author of The Social Role of Touch in Humans and Primates. He spoke to my colleague Johnny Diamond.
All primates are intensely social animals, probably the most intensely social of all the animals on the planet. And they build these friendships with each other through social touch in the form of social grooming, which they do by leafing through the fur. And we still do that, especially mothers fiddling with the hair of their children. It's exactly the same movement. So the problem we have, unlike the other primates, is that we've lost most of our fur, except sort of on our heads, as it were. And we've just replaced the movements that we primates in general use for grooming by general touch, cuddling, patting. But we use exactly the same set of neurons in the skin that primates use when they're grooming. So this is a very specialized set of neurons, and the only thing it responds to is light, slow stroking at a very specific speed, which is about 2 centimeters a second. These neurons kick off the endorphin system in the brain. The endorphin system is an opiate. It's part of the pain management system. It gives us a sort of light sense of light, contentment, happiness, and trust in the individuals we do it with. So it's really fundamental to the way we create our friendships and closer relationships.
What about the lack of it? Do we know what that does to us, if anything?
It certainly weakens your closer relationships because we don't do this sort of touchy-feely stuff with everybody, strangers, for heaven forbid. That's why we shake hands with strangers and do no more.
Right.
Sort of more intimate touching, arm around the shoulder and a pat on the arm and these kind of things are reserved for closer friendships and family members. And these are really important in not only making you feel more contented and happier and more satisfied and engaged with the social world, indeed more trusting of the people you live with in general, more trusting of the wider community, in fact. So this sort of chemical mechanism is really extraordinarily important in the whole basis of our sociality.
Professor Robin Dunbar. And that is all from us for now. There'll be an updated version of the Global News podcast later. I'm Oliver Conway. Until next time, goodbye.